So let me now introduce Becca. I've been working with Becca for these last sort of 2.5 years, helping support the bespoke training. And I have to say, I feel privileged to work with somebody with so much knowledge in this field. So if you don't mind putting yourself on mute, those who are in our audience, I would like to introduce Becca now, and I'm going to be screen sharing. Sorry, I think there's somebody who's not on mute. If you don't mind popping yourself on mute, thank you. So welcome, Becca. Make yourself known. Give a wave.
Thanks, Trudy.
You're welcome. So we are going into birth trauma, spotting the signs.
Okay, so I hope you can hear me okay, everyone. With classic timing, my laptop broke about 10 minutes ago, so I'm actually on my phone with Trudy very kindly sharing the slides for me. And I am a perinatal psychiatrist, and I'm going to be talking around spotting the signs of birth trauma. Please feel free to drop in any questions or comments or queries, and we will have time to talk about those at the end, and really welcome questions and reflections and discussion as we're going through. So we're talking today about birth trauma, and I think, it's great that we are talking more around birth trauma, certainly than when, I first started as a perinatal psychiatrist a long time ago. So I think it's something that we're gradually talking about more. And sometimes we might also use the term perinatal trauma. So what we're talking about is a person's subjective sense of what they found traumatic related to their birth, but also that might be circumstances around the birth as well. So it's not just the birth, it might be something antenatally, it might be something postnatally, and it might be one event, or it might be lots of different events that have happened at different times throughout a maternity journey. So, for example, it might be something antenatal. For example, we know that with hyperemesis, which is extreme nausea and vomiting, that if you look at those women as a group, that a lot of them, almost 20% in most of the samples, will go on to develop PTSD postnatally. And that might not be because they've had a difficult birth experience. It might be purely due to that antenatal experience of poor physical health. It might also be something antenatally with people coming into a pregnancy after a very prolonged period of fertility investigations or treatment. Or it might be postnatally. We often, think, for example, perhaps around breastfeeding, and that might be somebody's primary trauma. They might have had a subjectively relatively okay birth, but then found their postnatal experience very difficult around feeding, or perhaps if they've had a physical tear or bleeding as well. Next slide, please, Trudy. Thank you. And so these are some of the, quotes that really illustrate those kind of differences in where people's trauma might come from. And, they are very powerful. And I think that they really kind of illustrate that very clearly, how different aspects of everybody's unique maternity journey might become part of their trauma. And I'll put my hand up, and the hyperemesis quote is me. So I had hyperemesis with both my pregnancies, and it really was incredibly difficult and challenging. So I have huge empathy for people that are going through that experience and all of these experiences. So just to kind of reframe the thought of trauma as that we talk most about birth trauma, but actually sometimes it isn't the birth that is traumatic for somebody. So really perinatal trauma perhaps captures that in a bit more detail for people. Next slide, thank you. And just the reason we're talking about this, and I think it's worth reiterating, is that this is incredibly common, and there are a lot of people going through this each year across the UK. And we know from all the studies, and they're fairly consistent actually worldwide, we have more studies now being done all across the world, sort of capturing rates of birth trauma, and they seem to be fairly consistent worldwide. And we know that, you know, this commonly quoted figure is 25 to 40% of people find some aspect of their birth traumatic. And there was a study during COVID, and that went up to 50%, and it really comes in consistently at those levels. So that's 4 out of every 10 women finding some part of their perinatal experience really, really subjectively traumatic. And we know then that a smaller group of people go on to what we would classify as a clinical PTSD, a post-traumatic stress disorder. And really, to have a PTSD, you have to check off a certain list of symptoms, which we're going to talk a little bit about later on. But it's important to recognise that lots of people sit on the cusp. They may not have a clinical PTSD, but they have a huge amount of birth trauma symptoms, and these can persist for a very long time. So it's really important that we recognise and assess and treat trauma. And, you know, for me, I think we should be screening everybody for trauma if we can, postnatally, because there are these huge amounts of women and partners that are being affected. We know that trauma can, you know, go on for many, many years, and often actually postnatally peaks at around 6 months. And also we know that trauma can be coexisting or cause other issues for people like depression, anxiety, and OCD as well. And just a note to say that you will often hear birth trauma called postnatal PTSD, just to flag that that's not the same thing, that, you know, lots and lots of people are traumatized, but not all of them will have a clinical PTSD. And the differences in languages can really, really matter for people as well. So when we think about how that might present for people, how it might feel for people, you've probably heard of many of these terms before. So where we all want to be is in a nice, calm, orange bubble in the middle, which we sometimes call our window of tolerance. And really what that is our ability to respond to everyday stresses and strains without feeling completely overwhelmed. And what can happen after trauma is that essentially it's been such an overwhelming and distressing and frightening experience that you carry that forward with you and interact with the world expecting other really difficult things to happen. And what can happen is that your window of tolerance, that circle, shrinks so that you can't really handle stress in the way that you did before. And typically we talk about people going into these F's of traumas. So there are actually 5, but the ones that probably you will know most is that people will go into this fight, flight, freeze mode. So people feel triggered in a way that reminds them of their trauma. Perhaps they're driving past the hospital where they gave birth, and they might just feel very angry that they want to get out of there, that they want to get past it as quickly as they can, or that they feel they completely shut down and freeze. And that's a kind of hyper arousal of trauma. At the other end, we can get a flop where people get very sort of shut down and detached and really sort of feel very numb, very detached, like can't respond to things. And people can flick between the two very quickly after trauma. So you can see how difficult that feels for people when they're moving between all these different emotional states and feelings. But those types of responses are very, very classical of trauma. And you can read a lot around those in terms of sort of polyvagal theory, loads and loads of work that we can reference you onto if you're interested, but really thinking about how our nervous system is affected by trauma. We're just going to watch now a video with our CEO, Nikki, talking to, I think, one of our champions, I hope I've got that right,
Yes,
who had a traumatic birth experience herself and is going to talk a little bit more about some of the ways that she experienced that.
Hi, Chelsea.
Hello.
So we're going to explore a bit about how in the last 2.5 years, these symptoms of birth trauma and postnatal PTSD have played out for you. And then for context, for people that are coming in at this point, Chelsea had a very complicated birth with a C-section that lasted 3 times the average amount of time. She gave birth in the middle of COVID and therefore was highly impacted by isolation and rules and procedures placed around that. She suffered sepsis, added to her son, and cellulitis, and was on pain medication for the best part of the first year after having her son. So I know you have trauma therapy, Chelsea. So hopefully this feels comfortable enough. Please stop if there's anything that doesn't feel right. So we often talk about the kind of 4 symptoms of birth trauma and PTSD, and it might be that there's big overlap in all of these things. So it doesn't matter if things don't neatly fit into boxes. When it comes to kind of re-experiencing the events that you had been through, how did that play out for you? Was it certain reminders? Obviously, you were living with the pain. Flashback smells, memories.
When I saw the graphic that you sent through, I literally looked down and I listed a way that every single one of them had been relevant for me. Flashbacks, I think they happen regardless of what happens to us. Definitely smells, because I'd done hypnobirthing classes, so I'd had a smell with me, a little Neal's Yard essential oil fragrance thing. So every time I smell that, it takes me back to being on the ward. Which is not the best. They're lovely smells, normally. But really, for me, it's little things, looking after my son. So, as you know, babies get sick all the time. And every time he would be sick, that would instantly take me back to when I was sick. And I was obviously not able to move, and I was violently sick because of the pressure they were putting into my body throughout the whole procedure. So I was sick a lot. And I've now got a real big fear of being sick. So if he is sick, my husband has to deal with, it's a lot. It's really visceral. So I have to do grounding techniques after it, because it really does feel like I'm there. I don't know what it is about that specific experience, but it was really horrible because you couldn't really move. So yeah, that was one that I can think of immediately. But it's just little things, it will be sometimes things that people say. But you'll see things on TV, you'll see birth experiences on TV, for example. I probably couldn't watch any of those for about 2 years at all. Like, they would come on and we would stop, or it would have to be fast forwarded through, because they bring flashbacks to not very nice moments. I never got the golden hour, that you see everybody get when they get their birth experience in the media or whatever. So, I couldn't watch that for a really long time.
And you mentioned about avoidance when we were chatting earlier about how you separated yourself from your friends who you love. How did that work out for you in terms of avoiding people or places? Or
I would agree to plans and then cancel them last minute. I became that person. The avoidant behavior came out in a lot of different ways. I didn't want to socialize. If anybody wanted to do anything, it would be too difficult for me, too anxiety inducing, I would just get really upset a lot. And to be honest, that happened really up until a couple of months ago. And I don't necessarily know if it's passage of time or anything else that changed that. But avoidant behaviour, I've actually put it as number one. When I got your graphic through, I put it as number one of my behaviours that I exhibited throughout all of this time, and then only realised a few months ago when I started seeing my trauma therapist that it was birth trauma that was the reason. So I didn't know that it was that. I just thought, I honestly, it all stemmed from feeling not good enough. There's a lot of feelings of guilt around what happened. I think the tricky thing about this particular complication that I had is that there's very limited research about it. That is largely because of the nature of complication that it is only diagnosable once you are on the table. So it's obviously it's going to be really poorly researched. The problem with that then being is that, you know, was there something I could have done differently? Crept in and it stayed there for a really long time. And I think that context was and to be honest, like, you know, I'm lucky in a lot of ways. I do have a really supportive husband. He, you know, wants to do everything and take care of our son and be really present. And I know I'm lucky in that respect. When it came to this, he didn't have a clue how to talk to me. Like, everything would tip me over the edge, every single thing. And I know, because he's told me since, that, you know, he was walking on eggshells for a really long time, which, you know, has an impact on him. Not that I want to say that everybody else's experiences is more important than mine, but like, I think that, again, I'd forgotten, and I think you alluded to it at the beginning, I'd forgotten that what happens to you happens to everybody else as well. And a lot of my guilt is also tied up in that. You know, I'd felt bad that we hadn't been able to let my parents know how I was for nearly 7 days, you know, because we were literally just surviving day to day. You know, a lot of it was tied up in that as well. So there was a lot of things that came into it, I think.
You used this word visceral, and I remember when someone first used that, and I had to Google it. What does that mean? But it's kind of a very felt experience, a very physical experience that people often describe with birth trauma. Can you say a bit about how that kind of very visceral, perhaps it felt like anxiety, that kind of sense of threat played out for you? You know, was it that you were more, like you're saying, walking on eggshells, so more irritable, kind of afraid of the world around you? I don't know, what was that for you, that experience?
I was really hypervigilant and really jumpy. So if something unexpected happens, I'd need like 20 seconds to just regulate my breathing again. You know, little things would, if anything like changed or if plans changed last minute, which they do when you have a child because they get sick all the time, you know, everything would just tip me over, everything. You know, and it was the visceral experiences is an interesting one because it kind of links back to the flashbacks. I am a really vivid dreamer anyway, and sometimes I will dream something that hasn't happened and I will wake up believing that it happened, and it takes me a couple of hours to come back to reality. And that happens to me quite a lot anyway. It kicked up a notch when I was pregnant because of the hormones, and then afterwards it became more about what had happened and re-experiencing it. Being back on the table, I was listening to one of my playlists at the time. So again, it's only for a couple of months have I been able to listen to one of the songs. And it came on actually when I was doing a shopping trip to see my friend recently when we were in the bathrooms. And I was like, I need to leave now. Like, no context. You know, these these little things will happen that you can't have any control over whatsoever. And so I had to come up with ways that I could at least cope for the duration of the moment without completely losing it, kind of thing.
Chelsea. And lastly, before we wrap up, just how have you, 2 years and 7 months is a long time. And as you said, you're only kind of recently coming to really understand this as birth trauma. It sounds a lot like postnatal PTSD. How did you get there? How did you get there to understanding that may have been what has happened to you? Did people lead you down different paths and alleyways in terms of diagnosis, or how did you get here?
So I've had a therapist for a while. I had been seeing her probably for about 6 or 7 years, I would say, on and off. And then I started seeing her again after the birth, because I was like, I just cannot cope with motherhood. And she is the one who put me in touch with someone who was a specialist, because she was like, I think you might need some specific trauma work that I'm not trained in, but I can help you find someone who is. So she put the feelers out on a load of like professional groups that she has that are really, they're just doctors. And the doctor that I'm seeing now reached out to her specifically, sent her website and said that she would like to meet me. And so I met her a few months ago, and she just kind of got me straight away, and she knew exactly what was going on. I had to fill out all of those crazy questionnaires and stuff, but doing those questionnaires, and even there's one that's on like trauma behaviors. I can't remember exactly which one it is, but it asks you to rate on a scale little things that happen and how you react to them and how you feel when that happens. And I remember going through that and answering probably 80 or 100 to every single one of them. And it was then that it clicked, that I was like, actually, yeah, this makes sense for me. And it's that got me thinking, well, actually, if it is really all just about that direct experience that happened then, shouldn't I go back and find out what happened to me? And so a lot of the knowledge that I bring to this conversation now is from the maternity debrief that I did less than 2 months ago, because I only read my discharge paperwork and my son's discharge paperwork less than 2 months ago, because I couldn't face it. And my husband had read it at the time, and he said, you don't want to read that, like, don't read it. But I appreciate that might not be right for everybody. Maternity debrief is not easy, because you go through every note that was written about you by the nurses and the doctors. And I did it with she's a senior midwife, specialized in complex birth, and she's done it for 20 years. So I will always relax more when it's someone that experienced. Firstly, I'm like, why weren't you responsible for my care at the time? Hindsight's wonderful. But she like doing that experience, and again, I came out of it feeling a multitude of emotions. So I can't tell you that I felt happy doing it. I can't say I recommend it, because I came out of it feeling angry that I followed all of the legal complaints process and did everything I was supposed to do, and they accepted no responsibility for what happened to me. And then 2.5 years later, I can speak to this person who is actually a person in front of me. She apologizes to me profusely, gives me a hug, and tells me that, like, it was really nice to meet me, and she wanted to come up and help me think about having another child and all of this. It was weird, and it made me angry, because on a very real level, having someone acknowledge that it shouldn't have happened that way is not helpful when it did,
Yeah.
So that experience was useful, and it's that really that kickstarted other things. it's kind of what made me realise that actually it's been a long time now. I should probably, you know, I've been seeing a physio for 9 months. You know, she's done wonderful work building back up some of my muscle groups that went back down to zero. You know,
Okay, I'm going to pause there and just give you a moment just to take in what was said. And there's just so much there within that particular video. I have to say, I probably should have paused it slightly earlier, so we're slightly overrunning in terms of our slides. So Becca, over to you, and we are going to go through these last few slides and hopefully give us 10 minutes at the end for Q&A.
Sure. Thanks, Trudy. So I think, you know, obviously Chelsea has really described all of these symptoms really, really clearly in the video there. When we're looking for birth trauma particularly, I guess we're sort of really looking for the first 3 groups of symptoms are really classical trauma symptoms, and they're very different to other things that we might diagnose, say depression, for example. It really depends on whether you make a diagnosis of PTSD. There are different ways to screen for that. So in the UK, we tend to use something called the ICD, which is just really a way to make formal diagnoses. But there's also something called the DSM, which is used more in America and as a research tool. But really, it's those first 3 groups that we've already kind of covered, that kind of re-experiencing of the birth or your trauma. And that might be in your thoughts, where you just can't stop thinking about it and it feels intrusive. It might be as visual flashbacks, where you see it like a film or a photo, or it might be in your dreams as nightmares. And it's really an experiencing that is not within your control. You might not want to be thinking about it, but it feels like it's a loop that's just stuck and is very, very difficult to distract yourself from. Avoidance, again, as Chelsea said, of, you know, the perfumes. It might be music, it might be going anywhere near the hospital, it might be, you know, avoiding having sex because that feels too triggering. So each person's going to have a very unique blend of symptoms. Heightened threat is that kind of feeling that because something bad has happened to you, that the world becomes unsafe and that something else might go wrong. So you're looking for things all the time, you're scanning, you feel really jumpy, you feel really irritable. And it often might be with baby, that you don't want anybody to hold baby, don't want to leave baby, are checking baby throughout the night, have the monitor with you all the time. So that kind of vigilance all the time. And I think really important to birth trauma and perinatal trauma in particular is often the huge sense of guilt and shame and blame that people hold. So I failed, my body didn't do it well enough, I've let people down, I have, you know, somehow not done it right, I couldn't feed my baby right. So huge amounts of often really difficult negative thoughts and feelings as well. So you can see how if you're holding all of those groups of symptoms, it's an incredibly difficult mix to be coping with, to have all of that going on at the same time. This is just a quick scenario. I know we're tight for time as always. We always want to spend more time than we've got talking about this, but just looking, I can just see Almas, the 4 symptoms to look for. Who does this? Well, I mean, I guess all of us can be aware of it, but clinically, it might be a GP, a health visitor, a midwife, a psychologist. But, you know, even for us, if we're seeing it in our friends or family, it might be a way just to kind of start that discussion. Although, of course, we're not going to diagnose, but it's just being aware of these as common symptoms of trauma. So this is a story from Grace, and we really just put it up so that, you know, you can again see her really powerful words. And, you know, to highlight again those symptoms, those key symptoms that we are looking for. And I'm sure many of you can kind of spot those. But just to, maybe if we go through to the next slide, Trudy. So these, are the things that we would be looking for. So, that feeling out of control, feeling frightened, that vigilance, assuming that there's danger everywhere, afraid to not be with baby, wanting to be with baby all the time, just finding it very frightening, the world, and that replaying of the birth over and over again, feeling angry as well, and avoiding people, avoiding friends, and just that that loneliness of it as well, like how difficult it can feel when you feel perhaps unable to share how you're feeling, or you're comparing yourself to other people. It can feel incredibly lonely. Just other things that we kind of touched on. So Chelsea said about she felt guilty for the impact, and we often talk about the kind of ripple of trauma. So it doesn't just affect the woman or the birthing person, it often tends to ripple out and affect their relationships with everybody else around them. So with baby, with their partner, at work, it really does kind of move into lots of different areas. So it might be around that excessive checking with the baby. It might be about an impact as a couple, how you communicate, sexual relationship, and just sort of social withdrawal as well. So looking for all the things that trauma can cause for people in every aspect of their life as well is also important. Increasingly, there is some literature around partners, which is good. So, there's a recognition that partners can be profoundly affected as well. It's mainly around fathers at the moment, but there are some people at the moment doing more research around same-sex families, which is good. And we know that, at least 10% of fathers can also 10 to 12% in most of the literature of men can also suffer from PTSD, and they can really have all the symptoms that we've previously talked about that happen for women. And also, there's often another layer for partners, because they really feel that they've watched the whole scene unfold in front of them. So they often talk about feeling very helpless, very powerless, feeling sort of sometimes literally that they're shoved to the side of the room or left sitting outside theatre alone. So often, I often see couples and they will both relay their story in a slightly different way according to what they've seen, how they've felt. So it's good that we're beginning to think about families and how they can be affected about trauma as well. And we have some partners page on our website as well, which has got some links to some of the literature as well. We also need to we just wanted to flag up about misdiagnosis. I think, it's something that we hear all the time, is that people go and see their GP or their health visitor and they're told that they have depression or anxiety when actually they have trauma or PTSD. So there are actually those key differences, those first three, that re-experiencing, avoidance, and kind of hypervigilance, is very unique to trauma. So it's important to kind of tease out between the two. And it's important because sometimes people get sent off on the wrong treatment pathway. But really with postnatal depression, you're looking for a sort of constant low mood and loss of enjoyment in life, whereas sometimes with trauma, people will have up and down moods and feel their moods very all over the place and feel much more angry and irritable. With anxiety, you will have just a persistent anxiety and a sense of threat. And it's usually not so much linked to the birth itself. It's just a general anxiety about the world. It's not specific to the birth making you feel anxious. So there are those kind of subtle differences that you can see. And obviously, there's other things that might be going on that are really important, like a puerperal psychosis, and, things that can become a psychiatric emergency. But really just to flag that, it's important to make sure people get a proper assessment so that they are sent off with the right support that they need. And we do know that lots of people get diagnosed, particularly with postnatal depression, I think that's because what we tend to screen for most in the UK, whereas actually in reality they've got a trauma and nobody's really ever asked them about their perinatal experience in depth. Just quickly, that there are some standardised scales that you can use and may use already. So the City Birth Postnatal Trauma Scale is particularly related to PTSD and birth trauma. There's one for partners as well, and it is translated into lots of different languages. PCL5 and IESR are probably the scales that Chelsea talked about having to tick, and they're really screening for trauma in a really in-depth way. And that might be used by therapy services or a psychiatrist to kind of make a formal diagnosis. And the last two are more around fear of childbirth, which can sometimes, of course, happen in a subsequent pregnancy. If somebody has had a really traumatic birth, it can make the thought of having another pregnancy understandably really, really anxiety provoking. So just thinking about, you know, what you can do. Obviously, this is a short whistle stop tour through, but it's amazing that so many of you are here today. So just, you know, reading around it a bit more if you're interested in it, and thinking about holding in mind that so many people are being affected by trauma, and thinking about the way that it might present and how that might be different from depression or anxiety. So looking for those signs of trauma that we've talked about. If you think they're there, then, you know, perhaps using some of those scales, which can then give you, you know, work towards a referral or a formal diagnosis with somebody. And also just, you know, the importance of partners, not only in looking for if they've been affected as well, but also about that kind of support is really, really crucial in helping people through when they've had a traumatic perinatal experience.